Hello everyone, today we have another case of Dr. Yackerman. This is a real case. This is the same as we talked before of internal whitening. What is the meaning of that? What's the difference between an external whitening and internal whitening? Many people ask that. Well, external whitening, you have the whole mouth. I advise always go to your dentist. But in this situation, internal whitening is one tooth that have a root canal treatment became black, or that one tooth that have a trauma, like in this case, and the patient was a victim of many years ago of physical trauma, and then she has another trauma, and the tooth ended up dead. She has a root canal here, and because probably most likely when the gutta percha, when they finish, the root canal looks well done. But apparently the tooth came dark when they did the root canal. It's because the material stayed too low. So you have to tell your dentist, can you try to do something, reduce the material so I can have my tooth doesn't become dark. So when the patient told me that she was for more than 10 years without smiling, she was crying, she was sad. So when I told her to come to the office, and we find out this tooth was dead, therefore needs a root canal. We did a root canal, but the topic of today is internal whitening. She was the most happy person because when we got in and finished the treatment, we find at the beginning this amount of stain. When you look this amount of stain inside the tooth and you open and all of this is dark, even though the picture doesn't show it maybe too clear, but it was extremely dark all inside the area. This is the interesting part is when I tried to see if she had inflammatory cells or the red tissue. The tissue was dead, but it was extremely fibrotic. That's what happened to your pulp. When this pulp is traumatized and then it tries to defend itself, it gets reduced, start getting calcified, it becomes fibrotic, and then you can see this nerve around it here. We take it out with a brooch, which is an instrument that we use in root canals. And the patient was all excited that she saw the nerve. And after that, after finishing the root canal, we prepare the space. And it's extremely important you ask your doctor, do I need to have anything protecting my root canal? And the answer is yes. You need to have 2 millimeters of Gerestore or a composite protecting the gutta percha, so the bleaching material that is very aggressive because we have a combination of 35% hydrogen peroxide and we have sodium perborate, and that combination creates a big bubbling, big liberation of oxygen. And the material, when we place it like you see in this picture, we place it with either I have to get an applicator and we go inside and then we put cotton with more of that material that we mix. It's a powder and a liquid, and once it's inside, it's extremely important that you know that material is very toxic, can burn your tongue, can burn your gums if you don't have a seal. If when you finish we put a cotton and your dentist is gonna put a material, be sure to ask your dentist, do I need to have to be careful? The answer is yes. It's better what I do. I place this type of material. This is a composite on the patient, so the patient doesn't feel anything rough, is gonna be happy, and between appointments, like this patient, is just a temporary. You're gonna see in a future picture what is the big difference. The big difference that when we finish the root canal with her, this patient was extremely happy because just by washing, irrigating the tooth, look what happened. This tooth is already a little bit more white than this one because we were working in this tooth, and we place already the bleaching material, and in the next pictures you're gonna see how within a week that tooth is gonna be whiter, and we're gonna start whitening the internal bleaching of this tooth so the patient can be very happy. After she finished the appointment, she called me crying. She was very grateful because we don't know the psychological effect when you think about it. It could be a man, it It could be a woman, it could be any gender. Humans, we are very sensitive that when our smile is not the correct one, we go through a trouble to feel timid or to don't be able to smile the way we want. So when you can do that change in the life of a patient is very important for me, and it's important also that you learn what are the right steps so you will never have a problem after internal whitening. If you have any problems, if your doctor have any questions, I give seminars, I give courses, workshops about that. If they don't want to come to the office, we can do it by Zoom, or I can direct it in a way as a courtesy for you, but just call, send a message, send you your comments in YouTube, Instagram, or TikTok. Thank you, and I hope you like it.